same size as a diabetic needle. Doesn't hurt because most of the people don't have any feeling down there anyway. And it's a very small amount. The Marcaine is the same thing, that we're kind of like the Novocaine that we use in teeth, and it gets rid of the pain. Temporarily, 5 to 8 hours at first, sometimes a day or so. But what it does is it not only gives the patient hope, but it shows them that there is, in fact, a relief. The lies that they've been told by the other healthcare professionals are just that, lies. Not lies so much as they just didn't know about this technique because it's relatively new. Now, are we, Dr. Harris, are we going to be doing home health care with these? Yes. Okay, great. That's what I thought. Okay, so here's the key to the treatment. If we could give a patient a treatment in our clinics, or if you went to a clinic, 3 times a week is about right. The problem is that 3 times a week really isn't enough. It's a 45-minute treatment, and we're trying to increase circulation. But what if we could increase circulation twice a day for 45 minutes? A 45-minute treatment with this is roughly equivalent to a half hour's worth of walking. What would a half hour's worth of walking do for a patient that has bad circulation in their feet? Hello? Would it help? Absolutely. Okay, but they can't, we talked about this, they can't walk, can they? Not very well anyway, right? So, 2 treatments at home, nice, easy, portable, on-off, easy to use. We talk them through it. They also get a little book that comes with it. And we will teach them how to use the device at home, or you will teach them. Somebody will teach them. It's really easy. I do it all day long on the phone. We send these out to patients, and I talk to them on the phone. Here's how you hook it up. Here's how you turn it on. Here's where you put the pads. The pads go real simply on the bottom of the foot and the outside of the leg. Real simple. Outside of the leg, bottom of the foot. Turn it up till they can feel it, and it starts contracting their muscles. And people will tell you, Larry, would you mind coming up here real quick and telling about your first treatment? Larry had his first treatment today. And he's going to tell you real quick about how it feels, because a lot of people are afraid of it, that it's going to hurt. Larry, does it hurt?
Not at all.
Okay, how compared to other things?
Okay, I was a cancer patient. I had chemotherapy and radiation. I've had neuropathy for about 6 or 7 years now, and I've done all sorts of drugs, all sorts of treatments.
I'm standing close for the microphone.
Oh,
Go
okay.
ahead. Go ahead. That's all right. Just talk to them.
All right. I've used TENS units before for injuries that I've had, and this was nothing like any TENS type of unit that I've ever had. We did it on both feet. We worked on both feet, and we were able to crank it up higher to cause more contractions in my muscles. And I was told that's what you're aiming at,
right,
is pumping the blood through my legs and into my feet. And I was able to crank it up higher without the sting, without the burning that comes with a TENS unit. And we did 45 minutes on each side. Mm-hmm. And that was earlier this afternoon. And even now, I feel much better. And I was really, I'm a skeptic, which is one of the reasons why they brought me to get this done. And I'm a believer.
Tell them about your knee.
I've had 5 knee operations, 3 on my left and, 3 on my right and 2 on my left. And I was worried that my right leg was getting weaker, and because it's acting up, and they hooked my knee up to the machine today, and that felt better also. I don't think it's, I don't know how long each treatment will last, but I'm bringing a unit home to work with it, and check back with me in a couple of weeks.
Thanks. Thank you, everybody. Thank you. Yes. This is a real medical device. It's not a TENS unit, okay? And it's, a TENS unit's like 50 or 100 bucks, okay? So how does it work? We already did that. Sorry. We have a program that is unlike any other program from any other manufacturer anywhere in the world. Our program allows you as a practitioner or you as a patient to take one of these home essentially for free if you're working with one of our doctors. Now, if you have insurance and so on and so forth, that's a whole different story, but we want to let you know that the cost for doing this, if you're with our neuropathy program with the doctor here, tonight, if you want to take advantage of this as a patient or as a practitioner, I want you to talk to the doctor before you leave, because it's the only time that you're going to get a chance to get one of these units for your problem or your patients. It's the most amazing thing you've ever seen. You're going to get a complete, by the way, we're going to give you a complete, comprehensive neurological examination. We're going to explain the personalization treatment program, and it's going to help you reduce or eliminate your pain and restore your balance and gait, and finally get back to living again. Okay? Does anybody think that that sounds like a pretty good idea? Have you ever heard of anything like that in your life? Okay? No. Okay? It is the best thing that you've ever seen. How can you get relief? We've talked about this, but you can come into our clinic, doctor's clinic, I'm sorry. Used to be, my clinic, I used to do this at home. Come into the clinic and you're going to get an evaluation. Now, I don't know what doctor has. I know she has a special price for you, for those of you who are patients. I know there's a special price, but I don't know what it is. It's normally about a $250 evaluation, and that's going to be a complete neurological evaluation. She's going to evaluate your peripheral circulation. She's going to evaluate the condition, your history, and so on and so forth. And I know that she has, doctor, do we have a price on that? I'm sorry.
Yes.
Michael? Doctor?
$99 for the evaluation.
Unbelievable. Unbelievable. We charge in Chicago, but I know we're more expensive there. I have never seen anything so expensive as a downtown hotel in Manhattan. Oh my goodness. I thought I was going to have a heart attack, and I can't handle that. I mean, I thought Las Vegas was expensive. I thought London was expensive. Oh my goodness. Okay, anyway, that's beside the point. It's just because it's so cool down there. I know to you it's nothing, to us foreigners. Downtown, we call it downtown. You don't call it downtown. Chicago, it's downtown. Here, it's Manhattan, right? Do we have other? No? Anyway, it's wonderful. My daughter and wife think when they're here, we don't come here very often, but every once in a while come to see some shows, they think they've died and gone to heaven. Then I look around at the garbage on the street and I go, not heaven. But that's... Oh, come on. That was pretty... Come on. You don't see garbage in Chicago on the streets. Of course, we don't have the shows, but... okay. All right, so, Dr. Harris, I don't have your address. I was supposed to get it. She's going to come up and tell you what her address is, and we're going to get you signed up. The thing is, the big question is, what have you got to lose? Those of you who are patients here, what do you have to lose? Except your pain. But you need to make a decision. Waiting for your neuropathy to get better isn't going to work. Doing what you've been doing and expecting a different outcome, that's not going to work. Hoping that you won't get sores and open wounds and toes cut off, ladies and gentlemen, that's just silly, because it's going to happen. I've seen it, doctor's seen it, we've all seen it, okay? Procrastination won't work. Or as we like to say in one of my favorite expressions is, I keep touching the microphone, analysis paralysis will kill you. Because if you're paralyzed by analysis, you aren't never going to get nothing done. That's Chicago speak for oops. Okay, so please, for your own sake, make your health care your top priority. Now, one of the side effects, the beneficial side effects of using this, if you were a diabetic and you were to go out and walk every day, 45 minutes a day, which is what I was told to do, and until I got really, really stupid or smart, I didn't do that. But once I started walking every day, I found that, oh, gee, amazing. My blood sugar went down. Isn't that amazing? Why? Because I'm asking my body cells to accept more of the sugar in, and it helps with the levels of insulin and so on. This does the same thing. This is the same thing as exercise because it's causing the muscle to contract and release every 3 seconds for 45 minutes, some 900 contractions in 45 minutes. Now, if you do that twice a day, as prescribed, okay, that's 1,800 contractions. That's a good workout. And that's going to activate those muscles. It's going to increase your blood flow. It's going to start absorbing and using the sugar, and the body is going to start managing the diabetes better. So what we find in most cases is that if the patient, we have to have the patient monitoring their blood sugar so that as the blood sugar begins to come down, and it does in most cases, not all, they can adjust, or their medical doctor can adjust their medications accordingly.